So, I've been a doctor for over 26 years, and I try to blend the best of lifestyle medicine and medical management using an evidence-based approach. As you know, fibromyalgia is complex and for too long has been ignored as a real problem, deserving of honest answers and practical solutions for real people struggling with pain, exhaustive fatigue, and debilitating brain fog. While you don't have fibromyalgia and rarely get a headache, usually it's triggered by an irregular sleep schedule. I'm passionate about those struggling with this often invisible and frustrating condition. I don't have any particular vitamins or herbal concoctions to sell you or to treat your fibromyalgia-related problems. If you are like many with fibromyalgia, you may wonder, why don't I sleep well? Why am I exhausted after sleeping for 7 to 9 hours? I asked those on the What Works in Fibromyalgia Facebook to share some questions about sleep and fibromyalgia, and here's some of those. Just how do we get a night of restful, restorative sleep? Can sleep also be affected by uncomfortable skin issues? Why do I get sore from sleeping? Why is sleeping so painful? I'll get some awful pain to subside. I drift off into bliss eventually, but then I wake up from sleep. I'm wincing from horrible pain before my eyes are even open. How am I in more pain than when I went to sleep? And share some of the medical reasons why fibromyalgia affects non-restorative sleep. And lastly, no matter my position, I'm uncomfortable, constantly feeling pain in one or multiple areas. My neck can never fully relax. My legs and feet can feel like I just ran a marathon overnight when I wake up in the morning. Is it just mind over matter? And as Melissa said, this is a talk for educational purposes only, and have all your signs and symptoms discussed with your individual doctor. There are multiple ways sleep and fibromyalgia are connected. Poor sleep is one of those causes. Studies have shown that a few nights of disrupted sleep or even one night of sleep deprivation will cause heightened pain sensitivity the next day. And I'll take a quick walk through some of the critical factors to help you understand the different sleep challenges that those with fibromyalgia have. I hope you will get some insights that go far beyond just a simple command to relax and sleep, which obviously you've tried and it's not working if you're struggling. Sleep problems precede fibromyalgia symptoms when you look at the chronology. Many with fibromyalgia have coexisting sleep disorders and medical issues that need to be identified and treated. And sleep hygiene is also essential, but often overlooked or inadequately implemented. So what is different about sleep in those with fibromyalgia? Unrefreshing sleep occurs in about 76 to 90% of those with fibromyalgia. When studies in sleep labs using EEG monitoring, they've shown abnormalities in sleep in those with fibro compared to those who are unaffected by fibromyalgia. These special EEG patterns, called alpha sleep patterns during the non-REM sleep, non-rapid eye movement, or non-dream sleep, have been observed with 3 distinct patterns of this alpha sleep activity. One is called phasic alpha, and this is kind of where we get a little bit nerdy here. I pardon you that, but there's this phasic alpha where these alpha waves simultaneous with the delta wave activity. In about 50% of patients, there's a tonic wave continuous throughout the non-REM sleep, and 20% of patients in low alpha activity in the remaining 30% of patients. The low alpha activity is also exhibited by about 84% of those who are control subjects who didn't have fibromyalgia. All fibromyalgia patients who displayed this phasic alpha sleep with the alpha and delta wave intermix reported worsening pain after sleep, compared with 58% of those with low alpha activity and 25% with tonic alpha. Post-sleep increase in the number of tender points occurred in 90% of patients with phasic alpha activity, 41% of those of patients with low alpha activity, and 25% of those with tonic alpha activity. All patients with this phasic alpha activity reported self-ratings of poor sleep, and about 58% with the low alpha activity and 12% with the tonic alpha activity. So patients with this phasic alpha activity reported a longer duration of pain than patients in other subgroups. Additionally, patients with this phasic alpha activity exhibited less total sleep time, lower sleep efficiency, and less slow wave sleep than patients with the tonic alpha sleep patterns. So to summarize, people with fibromyalgia are more likely to have a nervous system with this phasic alpha sleep consisting of this alpha sleep with the delta waves. It's like having a different operating system, making refreshing sleep less likely. This operating system leads to more daytime fatigue and more pain. The brain, the central nervous system, is plastic and can be modulated. Imagine a very intricately designed amplifier with many inputs and outputs that can turn the volume up and down on the sensitivity in the alarm system. And comparing that with fibromyalgia, can you take people who do not have fibromyalgia and induce fibromyalgia? Well, 2 studies did this. The first on college students in the 1970s, and a later study repeated in the 1990s in middle-aged women showed that fibromyalgia symptoms could be turned on and then off within a few nights. They had healthy volunteers, were monitored in a sleep lab for 6 nights, with intervention the first 3 nights and then none the second 3. When they were about to hit the deep, non-REM stage 4 sleep, a startling noise was played, awaking them briefly, and then these interruptions repeatedly kept them out of the non-REM sleep, deep sleep throughout the night. Why is that important? What is non-REM sleep and what is its purpose? It's a short-wave sleep characterized by low frequency and high amplitude delta wave patterns. It's where most of your restorative or restful sleep occurs. Brainwave activity and blood pressure are lowered, muscles relax, and your body can recover and repair. Non-REM sleep can help us physically heal, recover from illness, and deal with stress and solve problems. Non-REM sleep also plays a role in memory consolidation and can help boost the immune system. So in the short of it is, it's very essential, and a lot of those things overlap with what people with fibromyalgia struggle with. What symptoms developed in the subjects in these studies deprived of non-REM sleep? They observed aching or stiffness in the shoulders, lower limbs, neck, and upper back. All described overwhelming physical tiredness, heaviness, or sluggishness to the point of experiencing difficulty walking or standing up. Some related loss of appetite and transient nausea and diarrhea. During the recovery period, the regional symptoms tended to subside or disappear. The tiredness disappeared and they felt hungry again. All subjects exhibited bursts of an alpha-like rhythm intermingled with the delta frequency in response to noise stimuli during the stage 4 deprivation condition. These, as you know, were the same rhythms that we see in those with fibromyalgia. And the study's authors felt that the alpha EEG sleep reflects a vigilant arousal state. How to buffer the effects of noise-disrupted sleep? Well, those who had been in the study had led sedentary lives going into this, but a pilot study with people who were physically fit and accustomed to running 2 to 7 miles daily did not have any of the pain symptoms despite the sleep deprivation. Changes in Delafield scores, where they put pressure and see how much pain you have, those also did not change in those pilot study patients who were exercising at a pretty high level. So Maimonides, he's a physician in Spain from the 12th century, observed the potential for musculoskeletal pain in sedentary persons. He said if one leads a sedentary life and does not exercise, neglects the call of nature, or is constipated, even if he eats a wholesome food and takes care of himself in accordance with the medical rules, he will throughout his life be subject to aches and pains, and his strength will fail him. One of the ways exercise has an impact is through modulation of the volume control of the central nervous system involved in pain amplification. Consistent regular exercise turns down pain sensitivity. And sleep and fibromyalgia related, but which comes first, pain or sleep problems? Studies have shown sleep problems precede pain. Longitudinal cohort studies with basic subjective measurements of sleep and pain generally support a reciprocal relationship between sleep disturbance or insomnia symptoms and clinical reports. Good sleep means less pain, and several of these longitudinal studies convincingly demonstrate that insomnia symptoms significantly increase the risk of developing future chronic pain disorders in previously pain-free individuals. Existing pain is not a strong predictor of new incidents of insomnia. I just had a patient yesterday who is a 17-year-old that I saw who, looking back, he had growing pains as a kid and the nighttime growing pains, but not until he got into middle school and had a injury that in a sense unleash or trigger his now fibromyalgia symptoms that saw him for the first time yesterday, but had 3 years of symptoms before, without getting proper treatment. You may say, well, I know sleep is essential. Give me help. And what are the causes of poor sleep? And I know that, of course, hey, I'd love to exercise, but I'm tired. And all of these are interconnected. It's not so simple. So medical problems, maladaptive behaviors, environmental factors, and stress play roles, among others. Restless leg syndrome occurs in about 50 to 65% of fibromyalgia patients. For those who have fibromyalgia who have RLS compared to those without RLS, fibromyalgia intensity is worse as measured by the Fibromyalgia Impact Score. So, do you have RLS? There are 4 essential criteria for diagnosing it. So there's an urge to move the legs accompanied by or caused by unpleasant sensations in the legs. Sometimes the urge is present with unpleasant sensations, and sometimes these sensations are present in the upper body. Urge to move the legs is present when resting or inactive. The urge to move the legs is partially or entirely relieved with movement. And the urge to move or unpleasant sensations are worse at night than during the day and only occur at night and tend to worsen the longer someone is lying down. So consider these questions. Do you have insomnia or sleep problems and a need to move? And do you have uncomfortable sensations in your legs and sometimes the upper body? If you answer yes to these, then consider the questions. Have you felt the urge to move your legs in the evening or at night in the last week? Do these symptoms worsen when you sit down, lie down, or rest? And are the symptoms in the evening or at night worse than during the day? And does moving, whether walking or stretching, partially or temporarily relieve these symptoms? Other supporting findings are if you have a first-degree relative with RLS. Most who have restless leg have normalized their neuroatypical behavior and may be unaware. They are more likely to be night owls. Improvement with restless leg medications also supports the diagnosis. If you're unsure that you have RLS, I have my patients self-monitor their sleep for a couple nights. I say lay still in bed when you're there and see if you get that uncomfortable sensations with an urge to move. Most with RLS, especially if you've had it for a long time, have had it for years and they reflexively move their legs before the uncomfortable feelings set in. Also pay attention to your mind. Many with fibrom will be able to stay still, but they have racing thoughts, making it hard to relax and fall asleep. These racing thoughts are not to be confused with the manic thoughts of bipolar depression. They may be a sign of ADHD, which occurs more in those with restless leg syndrome, but most with ADHD do not have restless leg. And many patients were unaware of their own RLS symptoms until they were asked to self-monitor. Most RLS patients also have periodic limb movement disorder, referred to as PLMD, a sleep disorder affecting about 4 to 11% of the general population. And people with periodic limb movement disorder experience repetitive jerking, cramping, twitching of their lower limbs during sleep. These are known as periodic limb movements and happen about every 5 to 90 seconds for up to an hour. The movements disrupt the person's sleep, even if they don't wake up, and can cause daytime sleepiness and fatigue. Their bed partner will notice that they move a lot during the night. And at a patient once who I said monitor this, and over the weekend she had realized she had restless leg and periodic limb movement disorder. When she talked to her parents, her dad had the same symptoms. And her dad had always asked, why do the cats pounce on his feet at night, but not on his wife's when lying in bed? And interestingly, a question about sleep and skin conditions, I had a case of a restless leg and a condition called lichen simplex chronicus, which is a severe form of eczema in the lower legs, and was found in a teen, but not until after several dermatologists and primary care doctors failed to recognize the underlying restless leg syndromes contributing to persistent eczema. She was rubbing her legs together at night, making the eczema continue to fester, and then only after her restless leg was treated with gabapentin was a steroid cream able to calm down her eczema. In the past, restless leg syndrome and periodic limb movement disorder in pediatrics have been dismissed as growing pains. Many adults had symptoms of RLS in childhood, and RLS is strongly genetic. If you have a restless leg, pay attention to your children's sleep, as it tends to be about a 50% inheritance. And the first central pain syndrome, what I call the first central pain syndrome, is infantile colic. And 90% of those infants who have colic, one of the parents actually has restless leg syndrome. Exercise can help suppress restless leg syndrome, and I also recommend getting an activity monitor for daytime and nighttime that can be used as a tool to help diagnose and monitor for therapeutic doses of activity to stop their restless leg syndrome. I've had patients with that say, I didn't even, according to my Fitbit, My Apple Watch, I didn't even sleep, but I was in bed for 8 hours. But the Apple Watch said, well, you're moving all the time. And then that was one of the ways we recognized it. Also, it's a tool that I find that one of my patients who had it, we're treating it with gabapentin and had fibromyalgia symptoms as well. She got a job as a nurse's aide in a nursing home and was getting about 18 to 25,000 steps a day by just being on her feet. And it treated her restless leg syndrome, and she didn't need medication anymore. So recognizing, especially in the upper Midwest where the weather's getting cold and being outside in the summer, people generally often get more exercise. And when it gets cold out, hopefully they can try to maintain their steps by walking indoors or wearing warm clothes. Moving on to other medical conditions with fibro, sleep apnea should be screened in all with fibromyalgia. It's characterized by episodes of upper airway obstruction and frequent decreases in arterial oxygen saturation during sleep. It's a public health problem, and it's associated with impairment in the quality of life. Men are more likely to get diagnosed with sleep apnea, while the disease is monitored in men with classic obstructive sleep apnea symptoms, such as snoring, witness apnea, and daytime sleepiness. And women have symptoms like morning headache, fatigue, and insomnia, and exhaustion that may lead to the diagnosis of depression. And there's a quick screening tool called the Stop Bang Questionnaire, and that acronym stands for snoring, tired during the day, observed stoppage of breathing, high blood pressure, BMI over 35, age over 50, bigger neck size over 40 centimeters, and being a man. Treatment with sleep apnea and mandibular devices have been shown to decrease the symptoms of fibromyalgia. And there is also a stimulator that affects the tongue that also can be used if people don't respond. Are you someone who doesn't have sleep apnea or restless leg but can't fall asleep because you can't turn your brain off? A flurry of thoughts goes through your mind. Many of these may be harmful, perhaps unfulfilled goals for the day. You may wake up in the morning and feel overwhelmed, unmotivated, and have catastrophic thoughts about the day. You may have good intentions for the day but struggle to follow through. You may start a project, get off task, and don't complete it. Do you have an internal restless, anxious feeling and have difficulty sitting for long? These are just a few symptoms of ADHD, and ADHD occurs in about 50% of those with fibro, but it's typically overlooked. ADHD impacts fibromyalgia in many ways, but one way is its impact on sleep. Many with RLS also have ADHD, as discussed earlier, but many do not. Their body may be still, but their mind is always racing, and they're thinking about all the things going through the day. And when they were busy during the day, they could distract themselves in one sense, but now they're laying in bed and they have to deal with all their thoughts. And ADHD, if you have it, is one of the most effectively treated psychiatric conditions and can improve fibromyalgia symptoms as well in those with fibro and ADHD. There are screening tools that you can look at, attitudemag.com, the World Health Organization ADHD version 1.1 ADHD tool, and the DIVA 2.0, DIVA 2.0. It's a diagnostic interview for adult ADHD is a tool that helps, and obviously getting evaluated by somebody who works in that, which is kind of like fibromyalgia. It's pretty hard to find people that have a lot of understanding of that condition. Depression and also can play a role in those with fibromyalgia and can impact sleep, and if present, medication can be beneficial. A lot more could be talked just about that, but I don't have enough time. One side note with that is I know many people who have fibromyalgia have been told, oh, you're just depressed. More often that I note is that they are actually more frustrated than depressed. PTSD occurs more often in those with fibromyalgia as well, and there's a lot of overlapping symptoms which make getting good sleep more challenging due to the hypervigilant state of arousal. So when we look at the bed, in the bedroom, there's supposed to be an oasis of restoration, but for many, it's extra challenging. While many with fibro and insomnia have underlying medical problems, maladaptive behaviors also contribute, and that's a funny term that I picked up from Dr. Daniel Clow, who's done a lot of research with fibro. It's maladaptive behaviors are just bad habits that we've just been doing for a long time. What is worse than not being able to fall asleep and lying awake in bed? It's being bored and in pain, tired but unable to sleep. Some will go on electronics to distract themselves from the pain and break up the boredom. However, this short-term benefit can alter the brain's circadian rhythm through the effect of light. Sleep hygiene is essential, and lifestyle medicine, as I talked about, a big part of that, lifestyle changes, and we try to work with therapy instead of using medication. And there's one of the modalities includes a sleep prescription. So here's some general comments to keep in mind when it comes to a good sleep hygiene. Use the bed for sleep and sex only. Establish a regular cycle for bedtime and wake time. People who have fibromyalgia and related problems are very fickle. You don't do well with changes in schedule. I just had a patient, 17-year-old, and I said, all right, we're going to start. He had RLS along with other things and comprehensive approach. But I said, every day I want you to get up at 6 a.m. because he has to get up at 6 a.m. 5 days a week for school. Having these changes in the schedule is not a good. Increase bedtime peripheral cutaneous vasodilation through a bath or shower, socks or heating pad or for cold feet, non-caffeinated tea beverages to help relax. Allow air temperature to gradually warm the extremities. Minimize or eliminate bedroom noise and lights. If you have to take a nap, it's maybe helpful if you do it for less than 20 minutes, but longer naps can make nighttime sleeping harder. Increase daytime exposure to light. Ideally outdoors can also help your sleep hygiene. Increase daytime physical activity, and we can do a whole talk about exercise, but gradually increasing that over time is important. And one of the most effective tools for insomnia. Decrease light at night, so trying to limit light exposure before you're going to bed. Obviously electronic devices. Avoid alcohol within 3 hours of bed. And there's reasons for that, but alcohol can help you fall asleep, but then you have rebound insomnia. It doesn't allow you to get into the restorative sleep. Eliminate after-dinner snacking and avoid high-salt foods, which can affect the blood vessel tone and dilation. And minimize stress by starting to wind down an hour before bedtime and stop working or doing stimulating activities 90 minutes before bedtime. Music with these slower, maybe 60 beats per minute, meditation, guided imagery, and try to mitigate nighttime worrying, planning, and ruminating. So all of these things are complicated by a lot of things that are out of your control. Again, thank you for letting me talk about sleep and fibromyalgia. It is complicated. No two people are the same. And each person with fibromyalgia has unique internal and external challenges. Things that somewhat are in their control, but you can't control how your brain software operating system genetically is wired. You can't pick your own parents, so part of that is internal. And there are external challenges. Some of those you can try to change if there's medical conditions. You can try to hopefully consider in getting those addressed. And I hope this was a useful starting point on your journey to consider as you battle with conquering your fibromyalgia. If you haven't already checked out the podcast, please do. And if you have any questions, comments, or topics that you'd like me to cover, and if you don't get a chance to get your question answered now, email me at drmichaellenz@gmail.com. That's Dr. D-O-C-T-O-R and then M-I-C-H-A-E-L, Lenz, L-E-N-Z @gmail.com. I'd love to have your feedback to help. So a lot to cover. I could cover a lot more. I kind of wanted to get as much in and open for any questions that people have.
Thank you so much. I know sleep was a deep, deep topic, and there's so many details to go in through, and we're loving the comments here. People enjoying. Thank you, Dr. Lenz, so much. Let's see if we can catch any of these topics. So I know we were posting about sleep. I have a ton of questions, but I'm going to allow other people. Again, a former Insomniac Club who is working on a lot of sleep. So Brandy, again, got good sleep or 6 hours of sleep and how we function. I mean, with that too, as we look through some of the questions, Dr. Lenz, like functioning on this deep, restful sleep, like those types of things, what are we looking for tips to get more of the deeper sleep?
I think that there are some things that if you have underlying medical conditions, no doubt that's going to impair you. Your brain can't get to that. So identify if you have those. And then there are external factors. I was just talking to somebody, he has some chronic neck pain, not diffuse pain. And I was just seeing him in a physical, and I said, he's a police officer. And I said, well, how do you do on your vacation? How do you do on your weekends when you don't work? Oh, well, I sleep better. I don't hurt as much. And I think it's easy to say, relax, but all of those routines are harder to implement. So if you can get into those habits, but of course, busyness of life. Now I'm trying to wind down, but sometimes all of the things that I didn't have time for, now I'm contemplating. So it's really easier said. I know there's a lot of talk, Dr. Sarna and people who follow him, they talk about journaling. So I think sometimes that's a good idea. People who have faith, doing some self-studies or Bible studies or other things, writing things down. I think that's a helpful thing. I think doing things that are relaxing, that could be playing the guitar, playing music, and whether it's knitting, painting, crafts, whatever it is that's helpful. I think discussing deep conflicts, which sometimes in a relationship before you're going to bed is probably the worst thing to do. And I think so many couples do that. And it's like, okay, what about the kids? Did you say this? And it's like, oh, that's not relaxing me. I don't want to hear it.
You kind of have to set that boundary up front. Be like, deep, stressful conversations.
Yeah, and that's part of the reality. There are things, and I know people listening, and we talked about stress and PTSD briefly, but they have gone through deep traumas, and sometimes the partner they live with is struggling with addictions, and it's hard to relax. I didn't talk about this, but sometimes your bed partner has a problem that's keeping them awake. I had a patient of mine who was having migraines, and it was caused by his wife snoring. And I said, well, guess how it was cured? I said, well, for a week, just sleep in this, they're empty nesters, sleep in a different room. He said, I cured it. Earplugs.
There you go.
He didn't hear his wife snoring. He slept deeper. So and everybody's different, right? As you know, with fibromyalgia, not everybody has the same situation. You can be identical twins and yet have different spouses, different work circumstances, different children, and different stresses that are challenging. I think, like I said, sleep is a real important, it's exercise as part of that sleep, which is a catch-22. It's if you don't sleep well, it's hard to get motivated during the day to do that. And if you're tired and it's exhausted. Another tip, I think, is getting an activity monitor. I have patients who have an activity monitor, and I say, pace yourself. And they constantly have these ups and downs when I look at theirs, and they have irregular sleep schedules. And I think just recognizing, sticking to that, it's kind of like the technology we have. It's a great tool, just like if I have my patients who have diabetes and you see these Dexcoms and Freestyle Libres. Now you can say, holy cow, look what happened when I was in the summer and I was exercising, getting 10 to 15,000 steps a day. And wow, when I was sleeping well, or I was on vacation and was eating better. All of those, when they work together. And if somebody who is prone to fibro, they can't get away with staying up late on the weekend and going out and having drinks and eating late, and they just don't do well. It just, it's kind of like, I guess, what a hangover is to normal people, but that's like a person who doesn't necessarily go and drink. That's like almost the same parts of fibromyalgia, because you don't get in that deep restorative sleep. We can turn these things on and off, and I hope that there's some hope. A lot of these approaches that I use are combining all of these, and because I can prescribe a lot of the medications and also lifestyle medicine, and a lot of it's education. There's a lot of catastrophizing and fear that goes on with this unknown and uncertainty.
Well, there's so many combinations here, and I'm seeing the comments too with that brain, like you said, it won't shut off. You have pain insomnia sometimes, or like you said, you have to wake up in the morning, or you're not sleeping and you look over and you're like, oh no, it's this time, I'm not going to get any sleep, I have to do this. So the brain plays tricks on you at night, and you're trying to find comfortable spots. So there's so much to sleep, and there's so deep level, like you said, you have to layer it, multiple things to try on top of each other.
Mm-hmm. And I'm part of that problem of the spousal interrupting my sleep. I was telling Melissa about this a few weeks ago. Is my husband has always fallen asleep with a TV on, and I was not raised that way. We always had like complete darkness, complete silence. I raised my kids to do the same thing. So he's got the TV on all night, and as soon as I turn it off, he's awake, right? And I'm like, oh, we got to find something that can help, because it's keeping me awake. but it keeps him awake if we keep it off. So it's like trying to find that balance between your partner that you share that bedroom with, so that way you can both get sleep. And he's got a CPAP machine. So I'm like, isn't that the noise that you could play like where you sleep instead of the TV, like the white noise of the CPAP? So we're trying to find that compromise right now. It's hard.
It is tricky, and I'm not going to say anything about Michael and his sleep patterns for movement, for me being a vigilant fibromyalgia sleeper. But look at all these cheering you on with questions. I know I'm seeing some of our friends here, Dr. Lenz. So thank you for the fantastic info. We'll just go through the comments and see if I catch any questions that came up. But there's a lot of praise because we know how difficult sleep is for all of us. When it comes, Carrie's here, Dr. Tracy's here, who will be on the stage later today. Oh, Katie. Okay, well, we have this recorded and we'll publish it for you. But Katie has a shout out for your podcast series. So you do have a podcast. You have some podcast episodes on sleep that people can listen to as well. And go listen, subscribe to the podcast, buy the book as well. Okay, here's a question. Have you studied CBD oil with the combination of sleep at all?
So obviously not a lot of good studies on that. A lot of it's anecdotal stories of maybe people saying it's helped. So if I don't have strong evidence, I don't say take something if I don't have strong evidence. But interestingly, what I find is that if you have somebody who's using marijuana daily, there's a high chance that they have underlying ADHD and potentially RLS, and that they're self-medicating that brain that's turning on. And what may be paradoxical is that if you have ADHD and you treat it up to bedtime, that actually, you may think, oh, it's a stimulant, but actually it can stimulate your brain or help turn off a lot of those intrusive thoughts and help you focus on a lot of those self-care, a lot of those meditative kind of things. So it's just an interesting connection. I know there's a lot of people who use marijuana as part of their treatment. I don't tell people to do that, but I know that's part of that. I think it's also a lot of people self-medicate pain and mood and depression with alcohol. I don't recommend that. I know a lot of people self-medicate their ADHD with nicotine. I said to a couple of teenagers who were in with fibro yesterday and they were smoking, they were talking, and I said, well, that's a real good treatment for ADHD. The problem is it's got terrible side effect profile, but it may actually help you calm down and help with your attention, but it's just really bad for you. It's just the side effects are terrible. And but a lot of times people try things because what else? I don't know what else to do, and they may have some benefit. So.
Well, we're desperate, right? We're up, we're trying to sleep. I know when just with the worst insomnia days, or you're in a lot of pain and you have that pain insomnia, you just want to get some relief, because we all know, and Carrie said it very well, we're all nodding our heads with the sleep talk. Like, yes, we all know, but trying to implement it, like, what can we do? And especially with pain insomnia and moving around, getting comfortable, I'm seeing some white noise machines, so people are cutting out some of the noise, blackout blinds. I know I sleep in a cave, all of those parts of it. And people are talking about hot sleep, so like regulating your body temperatures when people have irregular systems, like they'll be hot at night, they throw off the blankets and they get cold. So,
and then you throw in, there's so many other aspects, just going through menopause and temperature changes can contribute. As a lot of times women may start off with sleep in menopause, and then they might start not sleeping well, they're not exercising, and it's almost like a downward spiral. And this is part of the piece of helping people get better. And
we all need a good night's rest. And I'm not setting a very good example for our fibromyalgia friends this weekend.
You're hypervigilant with getting this conference. It's on your mind. It's a big thing you care about. It's a thing that we care about things, and it's hard to turn off our brain. And people with fibromyalgia too, one of the questions when you look at this, and I look at going back to med school, is you learn physiology. How are things supposed to be? And then you learn about all the things can get broken in your body. And you might be, well, why? And then we go, why doesn't it happen more? And one of the questions is, well, why do I have this alpha delta phasic sleep if I'm more prone? Why does that happen? Well, we're not 100% sure, but it does happen. And it does explain that, this is this does happen, and it can be kind of turned on and off. You probably have some wiring. It probably is connected with that hypervigilant. We often talk about that autonomic nervous system and that hypervigilant kind of preset. Your volume control is turned at a very high level to start with, and you didn't pick that. And a lot of times when I listen to fibromyalgia stuff, people may say felt like they're being gaslit. Well, we're just describing things. It's not that you're willfully wanting to have this. You aren't. And that you wish your brain would allow you to calm down and relax, and it's just interfering. And this is a real problem. Like I say in the book, it's like real answers and real solutions for real pain, but also the long title would have been for real brain fog and real fatigue, because there's more than just the pain that goes along with it.
Yeah, definitely the fatigue. And like you mentioned, when you said exercising, trying to get this balance of you're really, really tired. You're really, really tired and in pain. So how do you then move your body and be told to be exercised? So it's such a circle, but sleep is this foundation right there. And getting sleep and the dysfunction for all of us with sleep, like you said, this vigilance or fatigue, and it's just endless cycles for most of us.
I saw that Katie brought up something really good too, is that people with fibromyalgia have a tendency to have difficulties with regulating body temperature. And I know a lot of people have been saying in the comments about, not being able to sleep at night due to not feeling cool. And I know for me myself, I get night sweats so bad that I'll have to sometimes change my PJs because I'm just sweating so bad. And this is with the fan on and, the AC turned down low, or in the wintertime, even having the window open. And so I had to get a mattress topper that was a cooling, natural bamboo cooling. I have a cooling pillow. The next thing I'm looking in is cooling sheets and the cooling blanket, because when I start sweating like that, I can't sleep, which is funny because during the day, I have a problem with being able to stay warm. My hands and my feet are always cold. So even in the summertime, I'll walk around inside with bundled up and like gloves on and stuff, because and it messes with you when you sleep.
Frustrating.
Yeah.
It is. And you've sparked such a conversation in the chat. So feel free to jump into the chat, because there's a lot. I mean, this is a huge, huge topic. And I appreciate you, Dr. Michael Lenz, for coming on and talking about it and starting it, because I'm seeing these comments flow. Everybody's sharing what they do. And just like Brandy said, we're almost polar opposites sometimes. So thank you, Dr. Lenz, for joining us on the main stage. We appreciate your time today. I know you're super busy. We posted the links, and we'll continue to share your links, podcasts, and books with the entire fibromyalgia community. Okay, we'll check in with you soon.
All right. Thank you.
Bye.